Once again, we want to welcome you all to our webinar workshop this Wednesday morning. Thank you for taking time out of your day to join us. My name is Brian Griffin, a marketing assistant here at Messer Financial Group. Many of you are already familiar with Messer Financial, but in case you don't know, we are an agent-focused FMO that started with 2 agents and now serving over 20,000 agents across 40 states, and we are still growing. So today we're going to learn how to grow our Humana Medicare book of business year round by recognizing selling opportunities associated with Humana's DSNP products, and also learn tips on how to create community-based marketing opportunities while working with DSNP beneficiaries. So we are lucky to have two distinguished gentlemen here to walk us through this process. Rusty Lamb, a broker relationship manager for the Atlanta metro area, and Pat Murray, also a broker relationship manager for Greater Georgia with Humana. Both have extensive backgrounds in the industry, and they're here to share some of that knowledge with us today. Before we do get started, just a few housekeeping rules. We're going to hold all questions until the end of this presentation. If you do have a question, just type in the box on the right-hand side of your screen, and we'll get to as many as we can at the conclusion of the presentation. Now, without further delay, Rusty Lamb and Pat Murray. Gentlemen.
Thank you, Byron. We're very excited to be a part of the team today and have an opportunity to present to Messer Financial Group and our agents around the state of Georgia. We value the relationship with Messer a great deal. We work very closely with Messer throughout the state and find them to be a long time, very valuable partner. So our team today that they'll be presenting is myself, Rusty Lamb. I'm the broker relationship manager for the Atlanta metro area. You can see my contact information on the screen. I've been with Humana since 2010, and I'm going to have my counterpart, Pat Murray, introduce himself. I manage the 21 counties of Atlanta metro. Pat manages those counties outside of metro Atlanta. So, Pat, introduce yourself.
Yeah, thank you, Rusty, and good morning, everyone. I'm happy you could join us today. My name is Pat Murray, and like Rusty said, I'm the broker relationship manager for Greater Georgia, excluding Atlanta. I do live in Augusta, but if you have any questions or needs in that Greater Georgia area, please reach out to me. You can see my contact information there on the screen. And I'll turn it back to Rusty to tell you about another teammate that we work with. Rusty?
Yeah, we're very fortunate to have a broker relationship team in Georgia. And in addition to the two broker relationship managers, myself and Pat, we also have a very valuable part of our team is Eric Redlin, our broker relationship executive. Eric works out of the Madison, Wisconsin office and handles and supports both the work that Pat and I do on the ground with Humana. So many of you have already spoken to Eric, but you can reach out to any of us at the contact information on your screen. We'll be more than happy to assist you. I do think it's important with the changing and unique times that we're in to provide you with a brief update. COVID-19 coronavirus update from Humana I wanted to provide you because this is changing each and every day as we continue to battle this virus. So I want to take a moment to share with you that Humana is waiving all out-of-pocket costs associated with testing for COVID-19 for patients who meet CDC guidelines. That includes waiving copays, coinsurance, and deductibles associated with any COVID-19 testing in a range of settings such as a physician's office, an urgent care center, or emergency department. In addition, Humana is also allowing early prescription refills for an additional 30 or 90-day supply as appropriate. These will provide extended pharmaceuticals for beneficiaries who need them and don't want to get out of their home. They can use Humana Pharmacy, which is one of our valued benefits on all of our plans in the state of Georgia. And then thirdly, our members have a member support line available by calling our customer service team at the number on the back of their card. They have a dedicated team to help individuals that are dealing with COVID-19. Also want to share with you, telemedicine costs have been waived for all urgent care needs, and we've actually just gotten an email this morning, hot off the press, that we are expanding our telehealth medicine, the cost share waivers for telehealth. We're encouraging members to seek safety while protecting their health, and Humana is waiving all member cost shares for telehealth services delivered by participating in-network providers, including telehealth services delivered through our MD Live product, which is part of our Medicare Advantage plans in the state of Georgia. So these are very important developments as we try to keep our members as healthy as possible. In addition, we're going to be having expansion of our telehealth services and telehealth channels, as well as multiple practitioners can now deliver telehealth services. Participating in network primary care and specialty providers can deliver telehealth services provided that CMS and state-specific guidelines are followed. So these are important things. At the end of today's presentation, I'll provide you with a flyer about our telehealth virtual benefit, which is called MD Live, which is a very important benefit. It's powered by MD Live and allows members to see a board-certified doctor through their computer or mobile device. So more information coming on that. COVID-19, we're also asking agents to be very cautious in working with our beneficiaries during this time. Health experts are asking us all to limit the face-to-face interactions we have with other people, including our members, especially those that are considered at risk, and a lot of our seniors are considered at risk with chronic illnesses. This presents challenges to our agents who rely on face-to-face sales. But one good thing is that we know that the World Wide Web has expanded to even the senior community. Most seniors have, in 2020, have had internet exposure now for 20 plus years, and we know that more and more seniors are tech savvy. That means agents can be tech savvy, doing presentations virtually on the phone. We have capabilities to assist you with enrolling beneficiaries electronically, and I'm sure Messer Financial can support you with that as well. Having member discussions at this time is extremely critical, making sure you're having the right conversations at the right time. It's a wonderful time to reach out to your beneficiaries, many of which are feeling very isolated in their homes. Tell your members you're invested in their health. Ensure they understand the Humana's resources to assist members with questions about COVID-19 coronavirus, which is an important point. Make sure they are aware of Humana Pharmacy, reach Humana Pharmacy. Make sure they understand that Silver Sneakers has benefits where they can get virtual Silver Sneakers benefits. A variety of different things are available to our beneficiaries as part of our programs. Also, take time to listen and for cues from your beneficiaries. Ask questions about their social health needs, like having access to healthy food, transportation, and social connections, and help them connect to Humana because Humana does have local and national resources where we can support these beneficiaries during these unique times. So, again, these are the right time to have these discussions with your beneficiaries. I want to pivot now to talk a little bit about today's agenda. We're going to focus on low-income consumer insights, helping you understand the marketplace. This is a wonderful opportunity for you for year-round selling, and we'll talk about those year-round selling opportunities. I'm going to focus on LIS Fundamentals and Enrollment. Then I'm going to turn it over to Pat. He's going to talk to you a little bit about the dual SNP Fundamentals and Enrollment. He's going to also share with you our local plans in Georgia, dual SNP plans, both HMO and PPO. And then I'll finish the presentation up by talking about compliance updates, when you can enroll beneficiaries, and understanding the special election periods that are available to you. And finally, we're going to talk about coaching and support. As Byron said, we want to help you understand grassroots marketing opportunities for helping you to get engaged in this community once the opportunity presents itself. So let's talk a little bit about, if we might, low-income consumer insights. Helping beneficiaries find the right health plan has the potential not only to change the quality of someone's life, but it also has the opportunity to grow your business outside of AEP. Let us help you understand how to serve the low-income population in your community. We can help educate you not only about where these beneficiaries live and reside, but how you can actively market these beneficiaries so that you can sell Medicare Advantage plans year-round. Imagine it's a typical Monday morning. It's a Wednesday today, but on a Monday morning, a beneficiary wakes up and they've had breakfast and they're sitting at the kitchen table ready to check off items on their to-do list. They're trying to make a decision. Do I go grocery shopping or do I pay copays for that doctor's visit that I had last month? And a lot of beneficiaries are that. They have to make very difficult decisions on what they're going to spend their limited income on. Money's so tight they can't afford to pay for both the copay and to get groceries. They're going to have to make a decision. What would you do? So the good news is you can help these beneficiaries in low-income areas understand that no choice is really needed. They don't necessarily have to have a copay on a doctor's visit. In fact, with our dual eligible plan, most of our plans are cost share protected and provide a zero copay for all of the medical costs associated with that plan. And Pat will talk more about that later. Most of our plans have an over-the-counter benefit built in, so you can share with that beneficiary that they can have, they can get that leave that they need to help with their arthritis with a quarterly over-the-counter allowance. And most of our plans, in fact, all of our dual SNP plans include private transportation, so they don't have to take a bus an hour across town to get care. So again, not all dual SNP plans are the same. We'll go over those plans with you in just a minute, but all of our dual SNP plans offer outstanding extra benefits available to our beneficiaries. And most of our traditional plans also have outstanding extra benefits with Humana. So let's talk about growing your book of business while doing really good for others. The number of people simply can't afford their living expenses. The dual eligible SNP population in particular is growing every year. We see it in Georgia and we see it nationwide. That means the opportunity for agents to sell these plans are growing. And we have a lot of agents, many of which are affiliated with Messer Financial, that are doing a tremendous job on a monthly basis selling dual eligible SNP plans. In fact, they have an opportunity to grow their book of business each and every month, so that they're not just limited to what they're doing during AEP, but they've got a 12-month selling season. Humana really does have your back. We'll help you, provide you with innovative selling strategies to grow your book of business through our Marketing Resource Center, working with our strategic partners like Messer Financial Group to be able to design marketing campaigns to help you be successful in this space. One of my slides not here. No, it's not. There we go. There are nearly 51 million adults aged 65 and older. That number continues to grow. As the number of seniors continues to rise, it will become necessary to monitor and improve the health of the population and take action to improve the quality of life. 51 million adults aged 65 and older, and we know that there's a large percentage of that population also under age 65 that are eligible for Medicare due to having a disability for at least 24 months. So the opportunity continues to blossom. You're in the right spot to be able to grow your book of business. Let's talk about some consumer insights. We know that seniors living in poverty face significant health challenges, and that's an understatement. We also understand that individuals living in a rural area often experience greater health disparities across a wide range of behavior and outcome measures. Over the years, gender disparity has become a larger challenge. Females have a higher prevalence of physical inactivity, while males have a higher prevalence of smoking and excessive drinking. Just as a caveat, I don't know if you read the studies about COVID-19 and that it's actually impacting males a lot greater than females. So it's interesting to understand the gender disparity, not only from a low-income perspective, but how it affects a lot of our daily living as well. Adults without a dedicated healthcare provider are more likely to visit the emergency department for a non-urgent or preventative problem. We understand that those individuals treat the emergency room a lot like a PCP. We want to solve that problem and get them visiting a local primary care physician that can be the quarterback for that individual's healthcare. So let's talk a little bit about LIS Fundamentals and Enrollment. LIS stands for Low Income Subsidy. You probably heard it called special help or extra help. Low income subsidy, a federally subsidized program known as extra help, is estimated to be worth approximately $5,000 per year in overall benefits to the beneficiaries. It's important to understand that LIS, or low income subsidy, is administered by the Social Security Administration and Medicare to help people with lower income and resources. Often members are auto-enrolled into LIS by Medicare, or some must apply to qualify for low-income subsidy through the Social Security Administration. Income and resources must be below a certain level to qualify, and individuals who have extra help are allowed to make plan changes one time per quarter the first 9 months of the year, just like Medicaid. So again, the next to last bullet there provides you with that year-round selling opportunity with a quarterly special election period that I'll go over with you in more detail momentarily. Being LIS eligible does not mean they necessarily qualify for a dual SNP plan. They're two different qualifications. Again, LIS is a federally subsidized program, while Medicaid, which provides the ability for a beneficiary to qualify for a dual SNP plan, is a state-run program here in Georgia, the state of Georgia Medicaid, or the Department of Community Health. LIS, as I mentioned, is a federally subsidized program, and it impacts various things, but it mainly impacts the prescription drug costs associated with an individual's plan. That being said, if the plan has a premium associated with it, when you have a premium for an MAPD plan, if you think about the word MAPD, Medicare Advantage with prescription drug coverage, part of the premium is associated with the medical portion of the plan, and part of it's associated with the prescription drug coverage. So if someone does qualify for LIS, it will have a positive impact by lowering the cost of that premium associated with the drug portion of their plan. In addition, it helps them with their drug deductibles as well as drug copays, eliminating the drug deductibles and reducing the copays associated with their Part D prescription drugs. It does apply to most MAPD plans and PDP plans available from Humana. In fact, after this call today, I've asked Byron to send me a list, and I'll send you out an LIS chart that shows you the impact of LIS on all of our plans with Humana in the state of Georgia. Who qualifies for extra help? How do you know? You're not going to sit there and look at someone's card, and you really can't judge a book by just going in someone's home, because with LIS, an individual's home is excluded from the income and asset resource test for qualifying for LIS. So you may go into someone's home, it might be quite a nice home, but they still may be living paycheck to paycheck and may qualify for low-income subsidy. So it's important to ask the questions. If their income is less than $17,226 for an individual, or $23,274 for a married couple living together, they generally will qualify for Medicaid based upon the Part D LIS eligibility and benefits chart by the Social Security Administration. Some may qualify if their annual income is higher in special cases. There's a second test that they look at too. They look at an individual's resources. These are the assets they have developed or built up in their lifetime. If their assets or resources are less than $7,860 for an individual, or less than $11,800 for a married couple living together, they will qualify for LIS. All who qualify must have original Medicare Part A and Part B and reside in one of the 50 states or the District of Columbia. LIS enrollment. Once you find out that an individual qualifies based upon the income calculations I just went over with you, the income and resource calculations, then you can move forward with helping an individual apply for LIS. And the way you do that is to help the beneficiary in one of three different ways. You can help them by going online to www.socialsecurity.gov/extra help, and they can qualify for LIS online. Or you can have them contact the Social Security Administration at 1-800-772-1213. Or finally, they can go to the local Social Security Administration office once we get through this COVID-19 virus and visit in person to fill out an application. So three ways to qualify for LIS. After reviewing the application, the Social Security Administration will send your client a letter letting them know if they qualify for LIS. And they will let them know what level. Based upon an individual's income and resources, they can actually qualify at a 25% level, 50% level, 75% level, or 100% level for LIS. Follow up with your clients to be sure they receive their paperwork. If they've misplaced that paperwork, find out their status by calling our agent support unit, and they can assist you with verifying an individual's level of LIS. Then log on to Humana's Vantage portal, click on online enrollment, and view the plans in your area, clicking on the LIS premium to see if there's an impact to that person's premium. Of course, if someone's on a zero premium plan, even if they're 100% LIS, the premium won't go below zero. It still stays at zero. Your client may qualify for a low-income subsidy special enrollment period. LIS individuals can make one plan change per calendar quarter for the first 9 months of the year. You'll use the SEP MDE code to qualify those individuals, and you'll be able, for individuals who have lost, gained, or changed in their LIS status, may make a one-time change within 3 months of that change and use the SEP NLS. I'm going to go over these more in detail with you in just a few minutes so that you understand the compliance requirements to understanding how to qualify someone for a special election period. Excuse me. Once you presented the plan and your agent agrees to enroll, then you complete the enrollment by using a client's preferred method, either using the Messer tool, enrollment tools they have available for you, Fast App, Mappa, Enrollment Hub, or a paper application, preferably not paper. This is an example of how LIS impacts the Humana plans. And when you go into our online enrollment tools. You'll see a column there that shows the LIS premiums. You'll be able to view the details of plans by zip code and click on the LIS premium details. Different plans are impacted definitely differently by LIS eligibility, but be sure to explain the LIS premium amount only applies if they maintain the LIS status. So again, beneficiaries are primarily getting extra help for their Part D drug cost, but if there is a premium associated with a plan, they can reduce that premium by having LIS. Helping Medicare beneficiaries understand LIS is really one of the best ways to get access to more resources. It's important to understand that just qualifying for a dual SNP is based on dual Medicaid, Medicare eligibility through the state of Georgia. LIS qualification has zero impact on the prospect's eligibility for a dual SNP, but almost all beneficiaries who are dual Medicare, Medicaid through the state of Georgia also will qualify at 100% level of LIS, okay? So I'm going to now turn it over to my counterpart, Pat Murray. And Pat's going to walk you through another year-round selling opportunity that's just really blossoming in the state of Georgia. He'll share some statistics with you and plan details. Pat, take us through the fundamentals and enrollment of dual SNPs.
Okay, thank you, Rusty. So, quick refresher. Let's talk a bit. You're likely you already know what a DSNP stands for, but in case you've forgotten, it's Dual Eligible Special Needs Plan. So anyone who qualifies for both Medicare and Medicaid is considered a dual eligible, which is where we get the DSNP acronym from. DSNPs are designed to help dual eligible individuals achieve their best possible quality of life. They do this by combining their Medicare benefits and most of the benefits of Medicaid into one health plan. The good news, especially this time of year, is that agents, you can sell these outside of AEP. There is a rest of year SEP that much similar to the LIS that Rusty talked about, the MDE code, where they can change once per quarter. All right, next slide, Rusty. Okay, so DSNPs have many member benefits. First, they offer broad provider options. Members may be able to see providers who are not accessible through Medicaid networks. Second, they offer a variety of mandatory supplemental benefits and services, and that's really where the sizzle is on these plans. If you've seen your plans, and we'll get to those plans momentarily. In many cases, the DSNP members receive additional amenities like transportation, to and from appointments, dental and vision benefits and discounts, allowance for over-the-counter purchases, and discounts on hearing aids. Third, many plans include also gym memberships through Silver Sneakers. Silver Sneakers is a part of all our plans in the state of Georgia. So for agents, it's an outside, like I said, outside of AEP selling opportunity. So they have the quarterly SEP to enroll dual eligible members for the first 9 months of the year. The SEP for change of status eligible prospects, and the good thing to note is the Medicaid population is growing, so there's a lot of opportunity out there for you as agents. Why a DSNP might be better than a regular Medicare Advantage for a dual eligible? Well, DSNPs could offer more benefits for your clients than they're receiving now at low or $0 premium plans, because they include the MA coverage and work with the state Medicaid programs. Please keep in mind that dual eligibles can enroll in any plan they choose, but they might find added value in the DSNP plans. What's that saying there, guys, is they don't, just because they're a dual eligible SNP, they don't have to go into a DSNP plan, but they're losing a lot of benefits if they don't. So helping your clients understand the Medicaid versus the Medicare Advantage benefits. Medicaid, in many cases, may cover long-term care, including nursing facilities and waivers. Routine, not Medicare-covered dental, vision, hearing, non-emergency medical transportation, and prescribed meds not covered by the Part D and some over-the-counter medications. So those are the Medicaid may offer those options. Some DSNP plans may also include the benefits such as model of care coordination. So each plan contract has a model of care team made up of an interdisciplinary team of RNs, social servers, and health educators. Members are contacted within 10 days of the enrollment by a member of the care team, and that really just helps us coordinate their care and take better care of these members. To the right there, you'll see some of the added benefits. that they get from the Medicare Advantage plan: the dental coverage, the fitness program, vision, hearing, OTC, and of course the prescription coverage. So let's talk a little bit about provider networks. DSNP members have access to all the plan network providers. DSNP members are not restricted to the Medicaid certified providers. Medicaid certified providers are labeled as such, but members can see anyone in the network of providers for the Medicare Advantage plan. Next slide, we'll talk about a few of the Medicaid basics. So when we're talking of Medicaid, federal and state program providing health coverage to millions of Americans, eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. Medicaid is administered by the states according to federal requirements, funded jointly by the states and the federal government. If an individual is eligible for both Medicare and Medicaid, the type of MAPD plan specific to this qualification are referred to Medi-Medi or dual eligible plans. Dual eligible individuals can enroll in any plan, not just the SNP plan. The point I covered just a minute ago impacts medical and prescription drug costs, applies to certain areas where special need plan is available. The note there, DSNPs are not offered in all markets. We are fortunate in Georgia to have it in every county except 10 counties. Depending on income, some clients may qualify for both LIS and Medicaid. So don't intermingle the two. They are separate. They can have Medicaid and LIS. DSNP enrollment. So one of the most important things, and this comes up often, one of the most important things you can do before you talk about a DSNP plan and get that Medicare, Medicaid individual excited about the plan benefits, you always want to call to verify the member's eligibility. Now, normally I would tell you to call the market office, but with the COVID virus going on, we've had a lot of working on a skeleton crew. You can still call the office and leave voicemail, and they will call you back. We do have members of the team that are monitoring that voicemail box. So the Atlanta Market Point office, the number there is 1-800-986-9527. The Georgia Market Point office is 1-800-671-4055. You can also call Agent Support Unit during this time, and that number is at the top there, the 1-800-309-3163. And my tip there is just listen to the prompts, because there is a verify eligibility prompt. And if you're verifying eligibility, they move you to the front of the line in that call system. So you can call either of those any of those numbers to check eligibility, and it's very important to do that step. Another thing that comes up a lot, I hear agents say, well, I called United and verified eligibility. If you're going to sell them a Humana plan, please verify eligibility with Humana. So do not, see there it says agents should not call the state either to verify eligibility. Always call Humana to verify that eligibility. All right. Step 2, confirm that they are ready to enroll. So after presenting the plan benefits to your prospect, confirm they're ready to enroll. Remember, if your client is enrolling in a DSNP, he or she will need the Medicaid identification number. Then you complete the enrollment by using the client's preferred method. You can see the different methods listed there. Enrollment Hub, I would take out MAPA. So Enrollment Hub, Fast App, and Paper Application. We are sunsetting the MAPA application. Next step would be to complete the application. Not going to go through the MAPA step, but on paper application, the plan section includes a spot for the Medicaid number. You must enter this number in this spot. You will not need to enter the Medicaid effective date as you would do in MAPA. Identify the right election period to use. Refer to the enrollment options job aid for assistance in selecting which one applies, and we can send that out to you after the call is over today, the election period guide. It's a great document for all of the different election periods. Disenrollment from a DSNP. So eligibility for the plan is verified monthly. If a member's income rises above the eligibility threshold for any reason, they could be disenrolled from the plan. And we see this a lot with the dual SNP population. A lot of times they will go in and out of eligibility. The nice thing with Humana is, with our members, we give them a 6-month grace period to regain eligibility. And if at the end of the period they are unable to regain eligibility, Humana will notify members by letter of their upcoming disenrollment. So encourage your clients to contact you so you can help them navigate the next step. The most important thing there is that last bullet. If your members ever get anything from the state, from Medicaid, be sure they are contacting you, because you can let them know, okay, this is what's happening. We need to see about your eligibility. Don't worry, you've got 6 months on the Humana plan to gain that eligibility back. And within that 6-month period, if they gain that eligibility back, they continue right on with the plan. Now, if they do go, like it says, 6 straight months, in that 5th month, our agents get an email from Donna Smith or Bianca Marshall in our Atlanta office, and they will send them an email letting them know, hey, this member is in their 5th month of their deeming period. You need to reach out to them and help them make a decision on a new plan. So that's a nice feature with the Humana plan, that 6-month grace period. So let's look a little bit at our local plan details. So D-SNPs are available in more counties, like as I said before. They're available in every county in Georgia except 10. To keep up with the growth in the Medicare eligible population, the Medicaid eligible population in particular, Humana has increased this footprint. Next slide will show you a little visual representation. On the left there, you see 2019 footprint, and on the right, you see the 2020 D-SNP footprint. And just look at the expansion you can see just there in the Georgia alone. Georgia, South Carolina had a lot of expansion, as well as Florida. North Carolina has got a lot of D-SNP offerings as well. But let's concentrate just on the Georgia market. So our most popular plan is our D-SNP HMO. This is our richest D-SNP plan that is available, and this is HMO H4141003. You can see the footprint there on the map. It's available in the Albany area, Columbus, Macon. It goes up through Atlanta. We did expand it into Jackson County. Comes through the Athens area. We expanded it into Lincoln, Augusta area, and then down in the Savannah market as well. You can see the benefits there. One thing you want to note is the eligible categories, and it's that last bullet under key selling points. This particular plan is available for anyone that is QMB, QMB plus, Slim B plus, or full benefit dual eligible. Those are the 4 categories. Now, all 4 of those categories are cost share protected. So if you look up at the medical benefits, you'll see zeros going all the way down. Part D benefits, no deductible. You can see 0 for tier 1s and Medicaid copays for tiers 2, 3, 4, and 5. To the right there, you'll see the supplemental benefits. And like I said earlier, this is really where the sizzle comes in with these plans. A lot of times you'll hear these members say, I don't pay anything now. Why do I need your plan? Well, all these benefits on the right, they're not typically getting with the Medicaid. So we're going to give them, if you look at the dental, they have $3,000 annual max benefit. Includes dentures and unlimited extractions. The vision, they get the exam and $500 for eyewear. True hearing copay of 0 for advanced level hearing aid, and that's 1 per ear per year. Over the counter, they get a $300 per quarter allowance. Again, that is a user lose. They will have to use that by the end of the quarter. It does not roll over. Well Dine Meal Program is our home delivery of meals after a hospital stay. Silver Sneakers is our fitness gym membership. They're also going to get a Philips Lifeline Fall Alert system at 0 cost, and that is the system and the monitoring for 0. And transportation on this particular plan is 36 one-way trips of up to a 50-mile radius. So you see, this is a very rich plan. This is our most popular D-SNP plan. The next one that we expanded this year is our dual SNP PPO plan. This is H5216205. This was a hot seller because of the expansion counties. You can see it's a new plan. It's available, like I said, in statewide except for 10 counties, and those 10 counties are listed there. It's the Augusta area, Burke, Coffee, Columbia, Lanier, Lincoln, Lowndes, McDuffie, Richmond, Walker, and Whitfield. Again, this particular plan, the categories for eligibility are the same as the previous plan: QMB, QMB plus, Slim B plus, full benefit dual eligible. Again, as I said earlier, those are cost share protected plans. So if you look up to the medical benefits, you'll see zeros all the way down the page. Similar to the last plan, 0 for Tier 1 meds, Medicaid copays for Tiers 2 through 5. And when you get over to the supplemental benefits for this plan, this one is not as rich as our HMO, but it's still a very rich plan. You can see the dental, they get a $2,000 annual max that includes dentures and unlimited extractions. The vision, they get the exam and $400 for eyewear. They still get the 0 copay for advanced level hearing aid through True Hearing. The OTC on this plan is $200 per quarter. It does include the Well-Dine, the Silver Sneakers, also has the Philips Lifeline Fall Alert system, and transportation is 36 one-way trips up to a 50-mile radius. So this was a very popular plan due to the expansion and the opportunity to sell this to the dual SNP population. The next plan we'll talk about is H5216-206, and this is another plan that was new for us this year. As you see there, it is listed for full and partial. One thing to note, this is the exact same footprint as the previous plan we talked about, the 205. If you look at the eligible categories, this is QMB, QMB Plus, Slim B, Slim B Plus, and full benefit dual eligible. So I challenge you to say if they're QMB, QMB Plus, Slim B Plus, or full benefit dual eligible, you would put them on the 205. The 206 plan is really trying to catch those partials or that Slim B category. And again, remember the importance of checking their eligibility before you present any of these plans. Now, the key thing with the Slim B is they are not cost share protected, so they will have a little bit of cost share responsibility. So if you look at the medical benefits, it is a 0 premium plan. All these plans are 0 premium plans. The inpatient's $325 a day for days 1 through 6. Skilled nursing is $178 a day for days 21 through 100. Again, 0 for days 1 through 20. PCP copay on this plan is 0. Specialist, $15 copay. Outpatient surgery and advanced imaging is 20%, and that's similar to what they would be paying if they just had Medicaid. Part D benefits, you can see the deductible is $435. LIS limits do apply. Now again, if they're 100% LIS, that deductible goes away. And then on the copays, the LIS limits will apply as well. So if they're used to paying $3 and $8 for their medicines, those LIS limits will apply for this plan. The supplemental benefits on this plan, again, is a step down. It's not as rich. You can see the dental. It is a $2,000 annual max benefit. Includes dentures and unlimited extractions. This plan does include 50% coinsurance for out-of-network services. Vision, you get the exam and $300 for eyewear. True hearing aid copays of $99 or $399 for advanced or premium level hearing aids. So again, still a big reduction in the cost of the hearing aids. And again, that's 1 per ear per year. OTC on this plan is $125 per quarter. Does include the Well-Dine Meal Program, Silver Sneakers, the Philips Lifeline Fall Alert System, and the transportation of 36 one-way trips of up to a 50-mile radius. So this is our H5216-206. It says full partial, but I would really consider this plan the partial plan for those Slim B categories. The next plan, I know we can send you out a lot of this information after the program is over today, but you can access all the plan details through your Vantage homepage. If you just go to your Humana.com, sign in, agent broker, and when you come up to your Vantage, you can see the screen there on the left-hand side, all the way down. If you go to the Medicare document library, you can find all the summary of benefits, evidences of coverage, everything at your fingertips that you can download. So with that, I'm going to turn it back over to Rusty, and he's going to take you through some compliance updates. Rusty?
Thank you, Pat. Great job. And if you have any questions, Brian's going to make that available at the end of today's questions for Pat and I. So we'll cover those questions at the end. We're almost to the conclusion of our presentation, but it's important to understand kind of the do's and don'ts when it comes from a compliance perspective for both LIS and Medicaid dual eligibles, Medicare, Medicaid. So let's talk about the special election periods, which provide you the kind of the platform for year-round selling opportunities. Effective January 1st of last year, CMS did change their guidance. It used to be a monthly SEP, but they've changed that now for individuals who are dual eligible or who qualify for low-income subsidies and have not had a change in any level can enroll, disenroll, or switch to another MA or MAPD plan once per calendar quarter during the first 9 months of the year. What that means is that the beneficiary can make one plan change during the following time periods. Between the period of January through the end of March, which we're at right now, they can make an election to make a change. In addition, between the month of April and June, they can make a secondary change. And between July and September, they can make a third change. Now, when they get to the months of October through December, they'll be treated like every other Medicare beneficiary and use the AEP code for a 1/1 effective date. So again, you got 3 different election periods. If someone makes a change today in March for a 4/1 effective date, it would count for the first quarter change because they're making the change during the month of March. Even though it's effective in April 1st, they would still have that April through June election period to make a change. Individuals who have been identified at risk or potentially at risk for abusing medications can have their enrollment or disenrollment rejected by CMS. This limitation can last up to 2 years. This is a new rule put into effect to really help curb the abuse of opioids and other drugs that beneficiaries were moving from one plan to another to try to take advantage of getting more prescription drugs delivered to them that were really not good for them. So the change in status election period, okay, for the first election period we went over was for individuals who did not have a change. Let's talk about the beneficiary who does have a change. As Pat said, Medicare and Medicaid beneficiaries oftentimes have a change in their Medicaid status because of additional income or loss of income. So individuals who become eligible for any Medicaid or LIS or lose eligibility for any type of Medicaid or LIS, or if they have a change in level of their status of Medicaid or LIS, also earn a special election period that can be made once within 3 months of the qualifying event or notification of that update, whichever is later. The effective date of the enrollment request is usually this SEP is the first of the month following the receipt of enrollment request. That's standard in our industry. The disenrollment date, if they have a change in status, is always the end of the month in which the disenrollment request was received. This election can be used year-round. This is different from the quarterly DSNP special election period that I talked about on the previous slide, and the two should not be used interchangeably. As I mentioned earlier, during the fourth quarter, October through December, LIS and dual eligibles who have not had a change in level and wish to make a plan change must take advantage of the AEP election to make that change. You'll use the MDE election code during the quarterly election that I talked about earlier, but in the fourth quarter, you would use the AEP election code because the MDE election code cannot be used during the fourth quarter from December 8th to outside of the AEP timeframe from December 8th to December 31st, okay? Or I should say during AEP from October 15th to December 7th, or outside that from December 8th to December 31st. You may not use marketing or communication materials that intend to target this SEP during the fourth quarter. You would use the AEP marketing communications materials. So let's remind you about the change in status. If you want to have work with a beneficiary who contacts you and says they had a change in status, the SEP code that you would use for Medicaid beneficiaries would be apologize, it popped up on my screen. You'd use the MCD code for Medicaid enrollee beneficiaries, or you would use the NLS for extra help beneficiaries who have a change in status. Again, MCD for Medicaid dual eligibles, or NLS for beneficiaries who have a change in status for LIS. For the special election period we talked about earlier, for someone who does not have a change in status, they just want to use the quarterly election period. The quarterly election period for duals and LIS are the same. They're MDE. For the change in status, SEP, again, for losing or gaining status is MCD, or NLS for LIS. So these full codes will be on the election period job aid that I'm going to send out to you. It's also available on Market Point University, but I'll get the list and forward that to you at the conclusion of today's presentation. So let's talk a little bit about coaching and support. As Byron said in the introduction of our presentation, toward the end of our presentation, talking about grassroots marketing, it's really the lifeline of building your brand in the community. Being seen in a community, and grassroots marketing really includes strategic, targeted community relations activities designed to increase the business development opportunities. Quite frankly, it's very difficult right now when we're really supposed to practice social distancing. So this is really looking forward till when we get through this COVID-19 virus. Grassroots marketing is not a standalone experience. Correctly done, it's really a combination of some strategic or metric-driven marketing activities such as direct mail, media, advertising, and you need to take advantage of the tools that are available to you through Humana and through your FMO, Messer Financial Group. The Marketing Resource Center at Humana provides you marketing resources to help you develop your personal brand through grassroots marketing. Agents may only target marketing efforts exclusively toward dual eligibles if they're certified to sell our dual eligible plans. So you need to be certified to sell Humana before you can take advantage of grassroots marketing with Humana approved materials. Educational events. Educational events are very important in the grassroots marketing, especially with dual eligibles who really don't understand what are available to them in terms of plan design and plan availability. So by doing an educational event, you're informing the beneficiaries about Medicare Advantage, prescription drug plans, or other Medicare programs. At an educational event, you can display a banner and have promotional items under nominal value threshold. You can set up future marketing appointments, distribute business cards, and contact information for beneficiaries to initiate contact with you as a follow-up, and including completing and collecting a scope of appointment form. It must be advertised as an educational event with the correct disclaimers. You can serve a full meal at an educational event as long as the event meets the strict definition of an educational event. You must report these events to our local sales and marketing support executives. We have two of those in Georgia. One is Karen Osmond in Atlanta. The second one is Terry Hill in the greater Georgia area. You can send that information to Pat and I, and we can forward it to Karen and to Terry for you. Just because it says Medicare 101 doesn't make it an educational event. Make sure you're following the guidelines of an educational event. What you can't do at an educational event is you cannot include any sales or marketing activities or distribute marketing materials or enrollment forms during an educational event. You also may not distribute or make available any marketing materials that include plan-specific information, including plan premiums, copays, coinsurance, deductibles, or contact information. And you cannot discuss specific plan premiums or benefits associated with the particular plan. Sales and marketing events, on the other hand, are events that you schedule to actually do sales and marketing, just like it talks about. These events are different from educational events, and this is where a sales agent, a Humana-appointed sales agent like yourself, can promote Humana-specific benefits and services. We can actually certify you, Pat or I can certify you to do a sales and marketing event. You may accept and perform enrollments at these types of events. All events where Humana is being presented must be reported to our sales and marketing support executive, Karen or Terry, respectively. Sign-in sheets must be clearly labeled as optional. Health screenings or other activities may be perceived or used for cherry picking or not permitted. Contact information provided for raffles or drawings may only be used for that purpose and must be vetted by legal. I would stay away from raffles or drawings. Agents may require attendees to provide contact information as a prerequisite for attending an event. I should say you may not require attendees to provide contact information as a prerequisite for attending an event. And agents may not provide or subsidize meals at these sales and marketing events. You can have light refreshments at a very nominal value, like water, tea, that type of thing, and maybe a piece of pie or something like that. Okay. Informal events. A lot of agents are doing a lot more informal events. On the right-hand side of my screen here is a picture. This is one of our Humana vans that we have out in the field. Events are typically at a less formal environment and allowing the beneficiary to walk up to an agent and learn more about a product offering with a less structured presentation. These events sometimes are a table setup, kiosk, or an RV that is manned by an agent to discuss the merits of Humana's products. Event best practices. Consider wearing a Humana shirt. You can order those on the Marketing Resource Center. Have your name tag. Chat with the audience when they start to arrive. Stay focused in the short time you have to gain their attention. Keep conversations light and steer clear of topical controversial topics. That was hard for me to get out. You don't want to be talking about politics with them. Let them know that you have questions about the current or future coverage. You'd be happy to help them. Everyone, no matter their age, can be a referral source. So it's important with any Medicare beneficiary is just ask to be able to assist them. A lot of the agents are, working in our Walmart program. You may be one of those agents that are doing that. It's a great example of being able to be attentive to the agent's needs, not just sitting behind a table looking at your computer, but actually engaging yourself with beneficiaries. Excuse me. Your DSNP selling strategy, tip number one is to really build your sales funnel. The quarterly SEP change is a big change, but you can see it as an opportunity. Each quarter, you can use kind of a sales funnel approach to be able to develop your sales in the dual SNP and LIS community. Month one is get out in your community, go to the senior centers, food banks, et cetera, other types of things, churches, et cetera. Leverage our DSNP MRC, Marketing Resource Center marketing tools to nurture leads. I'll show you some examples of those. Be approachable and relatable for one-on-one sales meetings in the third month. So it's kind of a 3-month approach. And month one is being out in the community, building your personal brand. Meet with store managers at discount retailers and ask if you can set up a table. Host educational venues. Be consistent and show your prospects that you're a trustworthy expert to be able to assist them. Month number 2 is to customize CMS-approved marketing materials either through your FMO, Messer Financial Group, or Humana's Marketing Resource Center. Consider sending out postcards or flyers to dual-eligible beneficiaries. You can create print ads to put on church bulletin boards, community newsletters, and more. Build relationships and identify in the community by developing referral sources through your consistent approach, your expertise, and your trustworthiness. Again, building your brand once we get through this COVID-19 virus is about being out in the community and being seen and becoming, I guess you'd say, brand worthy. And then finally, in month 3 is be approachable. When meeting with dual SNP beneficiaries, it's important to dress down, not be formal in any way. Lead with your heart. Let them know you love helping people access the resources that they need to improve their quality of life and create and help them build their well-being as well. Explain the plan benefits and enrollment process in layman's terms to make it easy for them to understand how to use their benefits. It's also important to understand which SEP is right for the individual. Do you have a change in status SEP possible, or do you have a dual eligible LIS SEP? Again, I'll remind you of the differences. The change in status SEP is if your beneficiary comes to you and says, I recently had a change in my status and I need assistance, okay? Or if your beneficiary comes to you and says, I have both Medicare and Medicaid, or I get extra help, but I haven't had a change. You'll also know if someone has extra help by determining what they're paying for their drug deductibles, okay? Or the drug copays, I should say, excuse me. Tip number 3 is to make sure that you explain how cost sharing works in simple terms, especially in the dual SNP beneficiaries. Help them understand that if they're cost share protected, as Pat talked about earlier, they'll have a zero copay for all their extra benefits. And make sure you understand how they can utilize those extra benefits, which really separate our plans from our competition. You want to also show the impact on the quality of life. Help them understand that the extra benefits, like Pat went over with you, the over-the-counter allowance for things like vitamins, supplements, pain relievers, and others, are really can make a difference for them in terms of managing their quality of life and getting those types of over-the-counter items which they may not could have afforded on their own. These plans offer potential savings in addition with copays and associated with the plan. And the small things can make a major impact on the quality of life for that beneficiary for limited means. Just think about getting a free hearing aid for each year, 2 per year at a zero copay, or getting the monitoring for the I fell down and can't get up, or the potential up to $3,000 in dental coverage with first dollar coverage for dentures, as Pat talked about in our HMO plan, or $2,000 with our local PPO plan. These are major life-changing things for our beneficiaries. Again, I'll remind you how to verify enrollment. Again, during this time, it's best to call agent support at 1-800-309-3163 and follow the prompts to verify the member has the right level of eligibility. During normal times, you can contact our local Atlanta office or Georgia Market Point offices. The numbers are on your screen there. Enrollment isn't the end of the sale. It's the start of a relationship. So post-sale, consider going out on the Marketing Resource Center and pulling down a guide called the 30, 60, 90-day conversation guide. I'll send that out to you at the conclusion of today's appointment. It's a great way to have conversation topics, 3 days, 30 days, 60 days, and 90 days post-enrollment. These are available, again, out on the Marketing Resource Center, and I'll send you a copy of that guide. The Marketing Resource Center, we've done a lot of talking we've got about 4 minutes left. It contains pre-approved customized marketing materials to help you market to your prospects and your book of business, both during AEP and special enrollment periods. Here are some examples of marketing flyers, including pre-approved posters, ad flyers, and postcards, kind of designed for the Medicare and Medicaid beneficiary. The nice thing about it is you can customize these with your name and information as well as your picture to really do that. We also, on the far right side there, have an example of a generic non-Humana type flyer that's generic in nature if you want to keep your branding generic. You can also go out to our Ignite site on Humana.com. You can go to, when you log into Vantage, you can go on the left-hand side and pull up the Ignite website, or you can go to the website ignitewithhumana.com for additional podcasts, one-pagers, webinars, and more about dual SNPs and additional resources. Great material on how to sell to the dual SNP community. You can also find a lot more information on your Vantage portal at Market Point University. Browse the topics and enroll and launch courses about dual SNPs. You can get a lot of fundamental overviews of dual SNPs and how to work that population. Also, be an expert by going to the Social Security Administration for additional information. There's a couple websites on your screen there to understand how to work with extra help and how to help qualify your beneficiary if they're not on extra help, but you think they may qualify. So let's talk about our dual SNP next steps, and then we'll open it up for questions. I want you to consider brushing up on your local D-SNP plan knowledge. Once we get through the COVID-19 virus, I want you to consider using the Marketing Resource Center to build your brand and get out in the community. Plan your grassroots marketing strategies, and contact Pat or I or Eric if you have any questions. We're really just a phone call away. In addition to us being a phone call away, our agent support unit's only a phone call away as well, and they do an outstanding job. During these times with the COVID-19, we ask you to send any non-urgent requests by email to agentsupport@humana.com, or you can contact agent support Monday through Friday from 8 a.m. to 9 p.m. at 1-800-309-3163. So again, we're just a phone call away. We're really all in this together. I want to remind you of our contact information, mine and Pat's, as well as Eric Whitman, our broker relationship executive. We're really in this together, and want to thank you right now before we turn it back over to Byron for all that you're doing in the community to support your Humana members and what all you will do during these very uncertain and unique times. So Byron, I want to turn it over to you for any questions. I want to thank you again for the invitation to present today. We appreciate all that Messer Financial Group does with Humana nationwide and specifically in Georgia, and we look forward to continuing to grow that partnership moving forward. So I'll turn it back over to you, Byron.
Absolutely. Thank you so much, Rusty and Pat. Thank you for the information that you just shared with our agents. Definitely valuable. We do have just a few questions that did come in, so if you just have a few moments. The first question was, can you please go over the COVID-19 cost waivers again? I know at the beginning here, it looks like you did go over a few things that we're going to be, that Humana is doing specifically to make sure that folks are getting tested.
Yeah, so Humana is, as a company, announced earlier, you can find this on Humana's website at humana.com, but we're waiving all out-of-pocket costs, which include copays, coinsurance, and deductibles associated with COVID-19 testing. This includes related visit costs in a range of clinical settings, such as the physician's office, urgent care center, or emergency department. This also would include one of the drive-up testing centers. We're also allowing for early prescription refills. This allows members to get extended supplies of either a 30 or 60 or 90-day supply. Generally, if they go through Humana Pharmacy, they'll get a 90-day supply. They can get an extra refill on that or early refill to support them during this time. And also, we're providing a dedicated member support line on the back of their card where we have special trained call center employees to support members with specific coronavirus questions and concerns. We're also expanding our telehealth waivers for telehealth to encourage members to be able to use telehealth with any in-network provider. This includes in-network PCPs and specialists that are now providing. My son-in-law, for example, is a urologist. They just started this week doing a lot of their appointments by telehealth because of the COVID-19 virus, and Humana will allow them, we will waive those cost share waivers for telehealth medicine, basically. And multiple practitioners can develop and deliver telehealth services. So those are just some of the things that Humana are doing. You can find a lot of this information at humana.com, Byron.
All right, thank you so much. And another question was about the Well Dine Meal Program. It's not specific, but I'm guessing probably during this time a lot of our seniors can't go out. Can you explain a little bit about how that program works?
Yeah, they're actually looking at some expansion of that during this time. But Welldyne is a wonderful program that generally provides 10 meals after a post hospitalization, after an inpatient stay. So we're looking at ways that we can expand that. Um, Food insecurity is a big issue in the community, especially in working with individuals with lower income and resources that Pat and I have highlighted on today. So if you do have a beneficiary who's coming out of the hospital, Humana will automatically contact that beneficiary and send 10 fresh meals to that individual after a post-hospitalization. From what I understand, they're outstanding meals. They're provided by an organization called Mom's Meals. So we get great feedback on the tastiness of those and the promptness in which they come.
Excellent. And then also, just the last one here, do you foresee any SEP in association with this COVID-19?
Yeah, we just sent out an email this morning to agents. There has not been an official SEP announced. I know one carrier jumped the gun and thought there was an SEP, and I had to retract it. So you probably saw that, Byron. And
Yeah, I'm
you know,
sure did.
Humana is in contact with CMS on a daily basis, but they have not announced any special election period. There is some special election periods available, not in Georgia, but in other states would have a SEP due to a disaster. For example, the state of Tennessee in the Nashville community where they had the horrific tornadoes just a few weeks back. But right now, no COVID-19 special election period. They have not announced one officially yet. So we'll keep you posted just as soon as that's announced formally by CMS.
All right, thank you so much. I appreciate that. Rusty and Pat, once again, I want to thank you both for showing up this morning. And let me see, we may have one more question coming in here. One second here. Okay, it says if a person has a Humana plan but not the dual plan, do they just show their 015 card and the Medicaid card to the doctor until I switch them into a dual plan?
Yeah, so as Pat said earlier, when you're a dual eligible beneficiary, you don't have to enroll in a dual SNP plan, but I'll use the 015 plan for an example. The 015 plan is probably our richest HMO plan. That's a traditional non-SNP plan, has outstanding extra benefits, but the beneficiaries could be subject to copays and coinsurance, but they would present both their Medicare and Medicaid card. There would be some levels of cost protection, but the best thing for them to do and for you to do as their agent would be to take advantage of the special election period available to you for the first quarter. You could do that if you can meet with a beneficiary either virtually or in person if they want to do that. You could do that this week and actually move them for a 401 effective into either the HMO 003 plan, which would be the richer plan for them, or they could even move them to the 205 plan. The first thing you need to do is verify their level of eligibility to make sure that they are cost share protected. Just because someone has Medicaid doesn't necessarily mean they qualify for our dual SNP plan. There's roughly 8 different categories of Medicaid. So you need to verify that that person has either QMB Plus, SLIMB Plus, or full benefit dual eligible to purchase either the 003 plan or the 205 plan, or they have to have SLIMB, which Pat went over with you earlier, if they qualify for our partial dual plan, which would be the H5216-206 plan.
All right, thank you so much, Rusty and Pat, once again. And once again, I want to thank everyone for taking time out of your day for joining us. Hopefully, you did learn something new that you'll be able to implement in your business. I also do want to add an additional resource to you. Messer Financial's regional manager in Georgia, Ms. Karen Stiggers, is also available to any agents that may have some questions or need assistance. If you do need to reach out to her, number is 866-568-9649, extension 7736. If you are not appointed with Humana, it only takes a few minutes to go into SureLC, our online contracting portal, and request the appointment. If you have any additional questions about contracting, please feel free to contact our producer support department at 866-568-9649, extension 7813, or you can email them at producersupport@messerfinancial.com, and they'll be happy to assist you in any way that they can. Also, take a moment to check out our events calendar at messerfinancial.com. We will be having webinar workshops scheduled throughout the year with valuable information just like you heard today. And once again, thank you all so much for joining us. Take care of yourselves and everyone around you. Thank you so much. Have a great day.